Hello everybody, I'm Priya and I work as a faculty at the prestigious All India Institute of Speech and Hearing, Mysuru. In this video, I would like to share some basic information about speech disorders. Speech is very important for quick and effective communication, and so any hindrance in the components of speech can lead to breakdown in communication. Speech disorders include disorders of articulation, disorders of fluency, and disorders of voice. Before trying to understand what speech disorders refer to, one should know as to how speech is produced. The air coming out of our lungs move through our voice box, make our vocal folds vibrate, leading to the production of sound. This sound travels further upwards in our vocal tract, and when they reach the mouth, they are shaped into speech sounds by the movement of the lips, teeth, and the tongue.
It is very natural for young children to produce unclear speech. The correct production of different speech sounds are achieved at different age ranges. Generally, by the age of 4 to 5 years of age, most children are able to clearly produce all the speech sounds of their language.
When this does not happen and the difficulties in pronunciation persist, it is referred to as speech sound disorders or articulation disorders. Such children tend to substitute one speech sound with the other. For example, saying tar for car, or they might omit some sounds from words such as saying r for car. Overall, their speech is unclear and difficult to understand. The reason for these difficulties could include structural problems such as cleft of lip, cleft of palate or tongue tie, hearing impairment, intellectual disability where the IQ of the child is lower than what is expected of the age, damage to the brain, etc. However, it is also common to see these speech sound disorders in the absence of any known cause. Difficulties such as unclear speech could also be seen in adults due to brain damage or neurological disorders. Slurring of speech is a common symptom in a condition called as dysarthria, where there is weakness and poor control over the oral muscles. Such conditions need to be identified at the earliest possible and followed up with speech therapy. The second category of speech disorders include the disorders of fluency, mainly the stuttering or stammering. Again, very young children, less than 3 years of age, who are still in the process of learning to speak fluently, tend to have some difficulties while speaking. It is very common to see them repeat words or show some hesitations while speaking. But these are normal aspects of speech and children often outgrow them. However, certain disfluencies are characteristic of stuttering, such as getting stuck while speaking, repeating the sounds of words such as saying car or prolonging them. This could occur in young children as well, and hence it is very important to differentiate between the normal errors of fluency and stuttering. When left untreated, stuttering could persist into late childhood, adolescence and even adulthood, and the severity of the problem only increases. Such individuals may develop a sense of fear about speaking. In addition, it will lower their self-confidence and they often struggle in different communicative situations. In order to avoid the secondary complications of stuttering, it is important to identify the problem at the earliest and avail speech therapy to ensure that the faulty speech is corrected. And lastly, the third category of speech disorders is the disorder of voice. As explained earlier, the human voice is produced when the air exhaled from our lungs. The air coming out of the lungs causes the vocal folds to vibrate and sound is produced. This sound gets the distinct quality of voice as it moves further upwards in our vocal tract. When voice is not normal in terms of its pitch, loudness or quality, it is considered as a case of voice disorder. Voice disorders could occur suddenly or gradually. The symptoms of voice disorders can range from a simple change of voice to a complete loss of voice. The common noticeable symptoms include hoarse voice, breathy voice, break in the pitch, difficulty speaking for a long time, discomfort or pain in the throat, or a sensation of something getting stuck in the throat. Voice disorders are often caused due to abuse or misuse, such as excessive screaming, shouting, mimicry, etc., injuries, infections, severe gastritis, or other neurological conditions. Professionals such as singers and actors who extensively use their voice for their profession are at a greater risk of developing voice problems. So are teachers, vendors, salespersons, advocates, politicians, receptionists, etc., who are again dependent on their voice for their work. Anybody with a voice problem for more than 15 days should definitely consult an ENT specialist and a speech language pathologist. An ENT specialist will prescribe medications or recommend surgery when required, and the speech language pathologist will provide voice therapy to improve the quality of voice. The All India Institute of Speech and Hearing has state-of-the-art facilities for detailed evaluation and treatment of speech disorders. Our team of highly qualified, dedicated and experienced professionals are always ready to provide the best services at the most affordable prices. Teleservices are also available, which is definitely the need of the hour in view of the ongoing COVID-19 pandemic crisis. The Institute functions from Monday to Friday between 9 am and 5:30 pm. We urge the needy to make the best use of our services. Remember, early identification and rehabilitation is the key. Thank you.